I'm Betty Johnson, Assistant Dean for Faculty and Staff Diversity, Development, and Leadership at the Harvard T.H. School of Public Health, where we are committed to solving serious health and social problems facing the world. Our success in addressing these issues has huge implications for the future. No factor is more important to this pursuit than outstanding leaders. Therefore, the goal of Voices in Leadership is to highlight the experiences of those confronting these major challenges and to better understand what effective leadership is and how it can affect change. We believe these lessons and insights should be shared widely, and thank you for joining us today.
Good afternoon and welcome to Voices in Leadership, a series focusing on the nexus of science and leadership to create positive change in public health. My name is Eric Anderson. I'm the Deputy Director of this program, and I have the privilege of introducing our distinguished guest today. Jackie Jenkins-Scott has spent most of her life taking on leadership roles in challenging times. From 2004 to 2016, she served as president of Wheelock College. While there were many accomplishments during her tenure, she is perhaps best known for her commitment to diversity for both faculty and for students. From 1983 to 2004, Jackie led Dimock Community Health Center in Roxbury, Massachusetts, one of Boston's largest community-based health and human services organizations serving diverse, vulnerable populations. Under her leadership, Dimock rebounded from the verge of bankruptcy and emerged as a highly successful and sustainable benchmark institution that integrated comprehensive health and human services, including new programming and workforce development, child and family-centered services, and a community-based research program to develop innovative strategies for meeting the priority needs of inner-city residents. We're very proud that she is currently serving as a Menschel Senior Leadership Fellow here at the Harvard Chan School of Public Health, where she is conducting a seminar on leading in challenging times. Before I turn our discussion over to our moderator, Professor John McDonough, please join me as we welcome Jackie Jenkins-Scott to the Voices in Leadership series at the Harvard T.H. Chan School of Public Health. Thank you.
So, welcome everyone here and wherever you're looking from. What we really want to talk about today is leadership in community health. And I can't think of a better person to interview and discuss this with than Jackie Jenkins-Scott. We have a kind of secret relationship that people don't know. Jackie became director of the Dimock Community Health Center in 1983. In 1984, around your neighborhood, I was elected state representative. And so we were, I guess I like to call it partners in crime. That's over right. About 15 years in Roxbury and Jamaica Plain. But so you came into Dimock in 1983 and you were brought in as one of the court-appointed receivers to shut the place down because of its financial woes. Yes. What happened?
What happened? So I thought I was taking a job to work for Michael Dukakis. Remember Michael Dukakis, who had run for governor? And someone said, you know, there's this job, and we want to make sure there's some qualified people of color to apply. And I was, no, I'm doing something else. I'm going in a different direction. To make a long story short, after several meetings and interviews, I was asked to actually meet the board on the Dimock campus. And I walked on the campus and something said to me, this is where I belong. It was the spirit of the women who founded Dimock, and Dimock was a former hospital for women and children founded by immigrants, a Polish physician who came to this country believing that women could be doctors and nurses, and that women, poor women, should have high quality care. So the hospital at that time was, I think, about 110 or 115 years since its beginning. And the feeling was that this place didn't have a future. And in fact, the receiver, my co-receiver, gave me a real estate appraisal. And that real estate appraisal said, you have 10 acres of land here. These buildings are worthless. tear the buildings down, salt the land. Literally, you can see the Prudential Center from here. One day this property is going to be worth a lot, and it can turn into condos. And something in my spirit said, over my dead body, these women who started this place, we're not going to tear these buildings down. So that began a 21-year odyssey.
And how did you do it? How did you take something that everybody looked at and said that's heading for bankruptcy and create now what is really one of the most thriving and dynamic community health centers in Massachusetts and the country?
Well, we did it with a lot of help from a lot of people like you, great state rep at the time, and you believed in what we were doing and what we were trying. The staff there were incredible, but everyone was demoralized and depressed. And so part of what has to happen is a recommitment to the mission, to the values, to what we stand for, what we believe in. And when you're in a community surrounded by need, it gives you motivation and it gives you energy. So that started that odyssey with a lot of help and a lot of support. I tell a very quick story, if I can share this. So there were these 8 buildings or 9 buildings on the campus, all Victorian buildings, beautiful buildings. And many of them literally had squirrels living in them. One had a homeless man living in it. And part of it was, physical appearance matters. And, I always had the attitude that I want to be proud of where I work, how I serve, and the place ought to be good enough for my family. And so with that, we started a process to renovate the buildings, restore the programs. And I knew nothing about historic preservation, and this is a story about how we work together with people. So finally I got led to a guy named Stan Smith, who was president of something called Historic Boston. And that goes back to that commitment to what do we do with this place. Stan said, you know what, you need to get this place listed on the National Register of Historic Places. That started a process. So we actually, with the help of Historic Boston, was able to get the entire campus listed on the National Register of Historic Places, ensuring that those buildings will never be torn down and salted away for condos. Well, that's just the beginning of the story about how people can work together when we can find synergies. There was a guy named Bill Taylor who ran the Boston Globe, who was the publisher of the Boston Globe. The largest building on the campus had a roof that was leaking literally buckets of rain. And a program called Metco was in that building. And we needed to get the roof fixed. Well, back in the mid-'80s, we got a quote about $500,000, $500,000 to fix the roof. Today, that would probably be some unheard number. You know what happened? Bill Taylor was interested in historic preservation. I knew nothing about it, never met Bill Taylor. And after a long period of time, through some creative financing with historic tax credits, the Globe actually put up the $500,000. And what was really fascinating was Bill Taylor wanted no credit, no publicity. I think to this day, most people don't know how that roof got fixed. And that started a process of preserving that campus.
So let's back up a little bit. Where are you from, and what influenced you in your youth into this path and this direction that you've taken with your life and career?
So I was born in the South, and my family, like so many families of African American descent, migrated to the North. I grew up in a place called Flint, Michigan.
Talk about community health.
Talk about community health. And, in my family, we grew up with kind of 4 principles drilled into us. One was that education is power. And even though my grandparents and my parents didn't have a college education, I first graduated from college. Education is your way out, and it is something that no one can take from you. And one of the other, principles that was drilled into us was that there's a verse in the Bible that basically says, to whom much is given, much is expected. And so this commitment to service was something that was drilled into me. And then the commitment that we have to, today we call it paying it forward, that we have a responsibility to serve. So those basic principles were kind of led me to service. And I came to Boston for graduate school, and as they say, the rest is history.
But just have to ask you, what thoughts, reactions do you have around the community health crisis in Flint over the past 3 to 4 years now with the water? Any insights into that?
Yeah, it's been really tough. Actually, one of the lessons about values and commitments and capitalism, Flint was a thriving small city, 325,000 people when I grew up. The entire economy was driven by the automobile industry. My mom worked on the assembly line for 39 years for General Motors. And it is an example of what happens when corporations' values change. And so now when I go back, it's heartbreaking, absolutely heartbreaking. But what we learn is something that we learn about leadership. It's an important part of leadership is resilience. And you look at the resilience of the people in that city. It is a bouncing back despite the Netflix series that's going on. I think I admire the resilience of the people in that community. It's for me, I go back and I literally cry almost every time I go back because it's changed so much.
So let's come back to Dimock. About 21 years you were there as the leader, and then a leader in community health all over Boston, and a national spokesperson. Where is Dimock today, and what were you able to create, and how did you do it?
So I think, one of the important signs of leadership is the sustainability of institutions. And that was one of the struggles. I absolutely loved my time at Dimock. I actually had about 5 jobs over the 21 years because we're constantly changing. Dimock is thriving today. I'm going back next week. One of the buildings we didn't get to renovate before I left was the detox center, which was a detox center serving about 45 patients. And when I was there, we struggled because there was never enough reimbursement to adequately reimburse for substance abuse. Dimock has now invested $15 million into renovating the space, and next week they will celebrate the opening of that new detox center. So it's very exciting for me to go back. I had an opportunity to have a sneak preview of what the new space. It is absolutely beautiful, state of art, and it is one of my principles that every person deserves to have their services and care and dignity and high quality, and that's happening right on that Dimock campus next week.
We see a lot of interest today in issues around incarceration. And I recall one thing that we worked together on that you started in the later part of the 80s was a program for incarcerated mothers. Could you
Yes.
talk about that
Sure.
program and where that idea came from and
Yeah.
how you were able to make that happen, which was, again, kind of unprecedented?
So that's one of the stories that's a wonderful Dimock story. We had this beautiful building that was the laundry building for the hospital.
On Notre Dame Street.
Yeah, the laundry building was a great old brick building. That's the building the homeless man lived in and the squirrels lived in. And two women who were working at Framingham State Prison. And at the time, what happened to women in prison, if you were pregnant, you had your baby and you literally lost that baby within 24 hours of having the baby. So these two women had a vision of taking the women out of prison. Most of these women were in prison for, not serious crimes, taking them out of prison, giving them good health care, education, the opportunity to bond with their child, with the assumption that these things will help change their lives. And we had the opportunity to renovate this building. The laundry building was so it's aptly named. Provide the health care for the women, provide the early education programs for the women, and work in collaboration and partnership with the women from the prison. And that program was a partnership with Beth Israel Beth Israel Hospital at the time. Now it's Beth Israel Deaconess Medical Center, and provided excellent services. I think the program served about 20 women at any given time, and they were able to bring their babies, have their babies, first of all, in a healthy environment, and come back and live in the residential program for the first 6 to 8 months of the newborn's life, and then lead to a pathway and a road to recovery and a sustainable life. And that program, I think, lasted well into the early 2000s. It's a terrific opportunity.
I recall that neighborhood. I remember one house in particular, an elderly gentleman lived there. And when you went door knocking on the door, there was a sign on the door, and it was a cartoon of a gun pointing right at you. And it said on the sign, it said, "Forget the dog, beware of owner."
You've got a great memory, John.
Some things kind of stand out. It was a challenging neighborhood. There was a lot of security issues.
It was a challenging
Straddling the
neighborhood.
border of Roxbury and Jamaica Plain in Boston, and
Right in Eggleston Square.
But you didn't confine yourself to your campus. You were out. You saw yourself as an agent in the larger community in terms of the broader community health. And how did that come to you, and how did you make that happen so well?
Well, we had the opportunity. That is part of the hallmark of community health centers in general. Community health centers believe very much that you are part of the community and to have quality care. Well, our communities, the people who live in our communities are complicated. Life brings many issues, and we really took pride that our staff were people who lived and worked in the community, so they brought the issues to the community with them. And we always felt our job was to be responsive to what came in front of us. And we had this concept, now we call it holistic medicine, where you treat more than just the, presenting medical issues, but that people bring all of their issues and that we need to find a way to support them. So the fortunate thing for Dimock was that we had that opportunity to do some creative and innovative things because we had this campus of 10 acres sitting in the heart of the community, and it was an opportunity to really connect with the other pieces, important parts of the community, safety, housing, all the things that people care deeply about. At that time, we didn't have the Walgreens that's there now, things like that mattered. And what I found so incredible is the courage of the people who lived in the community, because they wanted good care, they wanted services, they wanted all the things that we want for our families and for our children. They wanted their children to go to school in caring, safe environments, and it was a privilege to be able to help to meet those needs.
So you took over Dimock in troubled times. Now let's kind of fast forward to today. Many people see us as being in really troubled, difficult times right now. Issues around racial justice, equity, immigration. Thoughts about our current environment and what you draw from your own experience in terms of facing the challenges of today?
You know, I think one of the things that we see, particularly in healthcare, because you'll know this, some of those issues have come around again 25 years later. You know, we called it capitation back then, and now we're talking about, the cost reimbursement structures changing again and really going back. So I think one of the things we, as leaders, and we have to think about is progress doesn't happen overnight. It is a process. We might take a step forward, we might have to take a step backwards, and we take 2 steps forward, and that begins the process. So calibrating success and having a sense of we are moving and remaining committed to that value of moving forward, I think is very important, and we're seeing that more and more today. We're seeing character matters, that values matter, what we believe in matters, and what we're committed to, what we're willing to stand up for, and what we're willing to fight for over a period of time really does matter.
Some people today get a little discouraged and think, are we really making progress, or do we just keep going through these same things over and over, and the sense of progress is kind of a delusion or just a mirage? What do you think? Are we making progress? Can we?
I was at Boston City Hall a few weeks ago speaking with some high school students, and it was for Black History Month, and it was a series of conversations. And this program was geared towards the students, but there were some parents who came. And at the end of one of my sessions, a gentleman came up to me. I didn't know him. And he thanked me. And he said, I was in your detox center when you were at Dimock. And I just want to thank you. Now, this was a man there with his high school student. And for me, that made all of it worth every bit of what we go through. So at the end of the day, it's about the lives we're changing, and sometimes we don't know who we're impacting. I didn't know that gentleman, wouldn't have known him, but he basically kind of said, you changed. This center, Dimock, changed my life. And that was, for me, worth it. It's worth all of what we go through.
We see kind of waves of interest in community health. I think back in the 80s and 90s, there was a surge of interest. I think some people saw a lull in the last decade. Do you see it coming back? And are there new ways of thinking about leading for community health today that's different, or is it just kind of sticking to the tried and true methods? What do you think? Is there anything new under the sun here in the world of community health?
So, we call the community health centers a movement. It was actually started in the mid-'60s. Senator Ted Kennedy was a big proponent of community health centers. And the first one started here in Boston and with a colleague health center in Mississippi. When I was a community health center director, we had something like 1,200 sites around the country. There are 8,000 now, over 8,000, serving over 24 million people. So what that says to me is that this movement really has value, and the numbers of people that it's reaching and touching has grown substantially. And in fact, community health centers, I think, did a fantastic job at helping to depoliticize being a community health center. So we have both Republican and Democrat support. Community health centers are not just in urban areas, they're in rural areas, and they're all over the country. So when we think about how we study movements, I think community health centers will go down in history as a highly successful movement, in part because they were able to galvanize support, but more importantly because of what they do, who they serve, how they touch lives, and how they recognize that they're part of a community. So some health centers are primary care focused as their major component. Others have added, all of them have added support services. Some health centers even run charter schools and other innovative programs to address the needs of the community that they're embedded in. And the idea of community health centers is that you actually meet the needs of the people that live in your community.
Mm-hmm. So people in this room, people outside this room watching, looking at this interview say, I want to be like Jackie Jenkins-Scott. I want to do what Jackie did. I want to become a leader in community health. What advice can you give them? What should they do or pay attention to if they want to follow your pathway?
Well, you know, I think that when you look at leadership literature now, when you talk about the attributes of leaders, nowadays they kind of can be lumped into four things: humility, empathy, curiosity, and resilience. And I think those characteristics are characteristics that not only are important for community health center leaders, but if we're curious, we're constantly learning and growing and evolving and helping others to learn and grow and evolve and meet the needs of their community. If we really can have empathy to the people that we serve, you know, we want to treat them the way we want to be treated. Resilience has to be, you know, a very important part of what we do as leaders, because it's not going to happen in a straight line immediately. So we have to be creative and think about, okay, we couldn't get that program funded that way. Is there another way we can get that program funded? How do we tell our story? How do we come back and keep people engaged in our work? And curiosity. So those are just some characteristics that I think we all have in us someplace. And we ought to own them and be proud of them. And that will allow us to do the work, because the work's not easy. You know this, John.
Mm-hmm. Absolutely. Jackie, thank you for your service and your leadership. Thanks for sharing with us today. And congratulations and good luck.